Dr. Jerry Mitchell, cardiologist at the University of Texas Southwestern Medical School, says that there's evidence in this country of a coronary epidemic, and this epidemic seems to be spreading to younger and younger men and to women as well. He and Dr. Gunnar Blomquist are perfecting a stress electrocardiogram test at the Weinberger Laboratory of the medical school to study the effect of exercise and other stress on the heart. Now tell me about the microphones that you've attached to the patient's heart, and there's another on the arm, is that right?
Yeah, we do two things. The microphone on the arm is just a simple device to measure blood pressure, but we do also pick up the heart sounds. Nobody has really looked too much at the heart sounds during exercise, but we've started to study them, and we think that we can pick up some information about how the heart is beating that you don't get in the electrocardiogram.
Well, are you saying then, Dr. Blomquist, that those who in the past have gotten resting EKGs might not have gotten the full story about their heart?
Yeah, that's true. Sometimes it really does take the stress of exercise to bring out the abnormal signs in the electrocardiogram.
Well, now, what I'm wondering about is you seem to have a good thing going here with your test, or people are beginning to be interested in it. It's being performed at all the hospitals in Dallas. How do you get this test into private physicians' offices so that a larger part of the population can begin to have it? Do you think this is coming?
I think it's coming up to a point. There some procedures, there's no doubt that it's more convenient to have them done in a lab, in a central lab. It's a matter of how much time you can allocate to doing the test. I think we'll find that many practitioners who are interested in the area of cardiology will be doing the test as an office procedure. But it is time consuming, and it does take some equipment to do it properly.
Now, Dr. Mitchell, you're a jogger, for instance. Suppose that a young man, 30, 35, wants to get involved in jogging or some other strenuous exercise. Do you think he would do well to have a test like this first, a stress test?
Yes, under ideal situation, he should have a stress test before he starts on any kind of a program like this. I'm afraid in our country now that isn't feasible, and in lieu of that, the man should at least go to his doctor and have as complete a checkup as he can, and then start out at a very, very low grade of exercise, no more than he's normally doing probably, and build up very slowly. Because all the exercise test really tells you is exercise back at this level, don't go further than you should, so that he just starts back at a very low level anyway. This is the safest thing that he can do in lieu of an exercise test.